Okay, so today we talked about rotator cuff
Yeah.
in rounds. How would you describe a rotator cuff to a patient that came in?
In the body, every muscle has its corresponding tendon. In the shoulder is unique because it's a large ball in a small socket, and so it needs extra stability. And so the rotator cuff is the series of muscles and tendons that surround the shoulder to give it more stability and help with motion.
Awesome. And what do you do when you suspect that there's a rotator cuff in a patient? What should we do?
So the keystone of medical treatment is a history and physical exam. So we try to tease out those classic signs and symptoms that you have a rotator cuff tear. Some of them are kind of a chronic ache in the shoulder that's been going on for a long time, and pain on the outside of the shoulder. Oftentimes, rotator cuff hurts with overhead activity, so trying to put that gallon of milk on the top shelf of the fridge, and hurts with at night is the other kind of classic history of rotator cuff tear. And then on exam, there's a special test for each of the 4 rotator cuff muscles that we try to evaluate the strength. Sometimes with a rotator cuff tear, you have what we call a difference between active and passive motion, meaning you can only lift your arms so high, but if someone takes your arms and move it, it has the ability to move. So one of the hallmarks of a really bad rotator cuff tear is the inability for you yourself to lift it, but like with your other arm you can, or someone else could lift your shoulder and move it through motion.
So weakness, but the ability, you haven't lost the range of motion.
Correct.
Yeah. So if we have a patient that has weakness on exam like that, or a story that's that's consistent with a rotator cuff tear, what would be our next steps in trying to better understand that?
So I think patients that get sent to us, we typically take x-rays to make sure that there's no kind of serious or unusual findings on x-ray. And then we start often with the basics of treatment. Activity modification, so avoiding overhead activities like, hey, have someone else put the gallon of milk on the top shelf, or put the gallon of milk on the bottom shelf, right? So avoiding those overhead activities. We often give, over-the-counter medications like Tylenol or ibuprofen, and then we start with physical therapy kind of as our initial treatment. And again, physical therapy to activate those muscles, get them stronger. And a lot of the smaller rotator cuff tears tend to improve. Advanced imaging is MRI. So if we have a concerning picture where there's a lot of weakness and the patient might be a surgical candidate, then we think about getting an MRI for the shoulder to evaluate the tendon.
Awesome.